Let's take some calls here. A lot of folks want to chat. Let's take Keith's call. He's calling from St. Louis. Keith, thanks for being with us. Go ahead.
Hey, thank you for taking my call. I frequently wake up in the middle of the night covered in sweat, even though my apartment is no more than like 75 degrees. I was wondering if that was due to poor sleep quality or sleeping conditions.
Well, I think that, and then I'll turn to Joe and Stephen, sweating can be a sign of distress, of what we call autonomic outflow from difficulty in keeping an oxygen level appropriate, although I wouldn't say it's the only thing that could cause that.
It certainly is. It may be in some people a sign of obstructive sleep apnea. It's one of the classical signs. I would also comment that 75 seems a bit warm for most folks, and depends what your wiring's like, but I know if 75 degrees asleep or not asleep, and I'd be sweating, so that can be an issue for you as well.
Sure. Turn down that thermostat, Keith, and give that a try.
And I think the other concern would be something like blood sugar variations, including low blood sugar, and so that has to be...
Should he go to his doctor?
I think, without doubt, yes.
Okay. Keith, thank you for the call. Let's take Christine's call. She's in St. Louis. Go ahead, Christine. Christine, are you there?
Hello?
Yes. Christine, go ahead, please.
Oh, hi. Thank you for taking my call. My husband is a shift worker, and I was wondering if there's any known health ramifications for that, and if there's anything that he can do to kind of combat the sleepiness that he gets after coming off a 12-hour set of overnight shifts. And I'll take my comments off the air. Thank you.
We're going to send that call to you, Stephen. Dr. Sheldon, go ahead.
Well, there are methods to combat shift work sleep disorder. People do not sleep the same way during the day as they sleep during the night if they are rapidly shifting their sleep phase. It's like jet lagging in the same time zone. Naps before going home, appropriate direction of shift, and appropriate timing of shifts is important. The most hazardous part is the drive home after that long shift, being sleepy, and it should be monitored. We see this in the healthcare professions, trainees, residents, and interns, where we teach them to take appropriate measures to either take a brief nap before they get in the car to drive home, make sure they have some caffeine before they get in the car to drive home, and if they can't, if they're too sleepy, then they should have someone else drive them home or take a taxi.
All right, Christine, I hope that answers your question. I have to take a break now. We'll do that, come back, and continue our conversation on sleep. We'll go right to the phones when we come back. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU. Hello again, and welcome back to our conversation on sleep, and a fascinating discussion it is. Let's continue with our listeners and bring in Ed, who's calling from St. Louis. Go ahead, Ed.
For taking my call. I was wondering if there's a way of determining an individual's ideal sleep time.
All right, let's. Who would like to take that? Ideal sleep time, Dr. Ojo? Well, there is sort of a simple way. It's rather blunt in its way, but when you don't have to work and you don't have anywhere else to go, to have that person sleep, go to bed at the correct time, and then sleep as long as they need for several days in a row. Once you satisfy frequently the natural, from our lifestyle, our sleep deprivation, once we fill that up, then you'll see how long your normal sleep time would be. The easiest way that we all do that is when we go on a vacation for, say, 3 to 5 to 7 days. That can be then at the end of that time, if it's a relaxing vacation, you'll see what your normal sleep time could be.
There's another issue I want to get to, and Dr. Sheldon, I'll send this your way. teen sleep is something that I think a lot of parents talk about, the fact that our teens don't get as much sleep as they should, and they're basically scheduled not to get sleep. And the other thing is that I'm sure you deal with is SIDS, sudden infant death syndrome, and sleep's role in all of that. Could you address those two issues for us?
Sure. First, with the SIDS issue, we still don't know what SIDS is. Sudden infant death syndrome occurs, but in the last 10 or 15 years, the Back to Sleep program has been the only thing in the last 150 years that has changed the prevalence, the frequency of SIDS in every single population that has adopted a Back to Sleep program. The American Academy of Pediatrics supports it and endorses all otherwise normal children should be placed on their back to sleep. It has decreased the frequency of SIDS in every population from 40 to 60%. And there's nothing else that has approached that ever in the history of SIDS research.
Go ahead. I'm sorry.
The second issue about teen sleep, it's quite a tumultuous time. The body is changing. We have an adult body being developed. There are hormonal changes that are significant, and in fact, a teen needs more sleep during adolescence than they needed pre-adolescence, yet they spend much less time in bed because they are overscheduled. They are socializing. They have homework. They have things that they have to do, and most teens can handle it. But those that can't handle the overscheduling and extra homework and after-school activities will often stay up late. Their biological clocks tends to drift, and on weekends when they stay up late, they jet lag on the weekends, and then they have to fix themselves during the week. So it's quite a difficult time.
Shouldn't we just start school later to deal with this? Because it is a problem. Dr. Ojo?
Well, I think the answer is very simply yes. We need to have the older children, adolescents should go to school a little bit later. It's biologically in sync. The younger children could start earlier. That we have a societal issue. One, the sort of subtext is that we think older children should get up earlier as a society, and we have to have that conversation, I think, all together. The other thing is there are safety issues at the bus stop. The older children can go to the bus stop early, and the little children can't. So we need to have some ongoing dialogue. Where it's been done, the performance in the adolescents academically has improved. And I think that's been consistent. Stephen, have you seen any data contrary to that?
No data contrary. I think in every single school system, it has been a benefit by starting school later. Even just an hour later has resulted in significant changes in performance, decreases in tardiness, improvement in performance, decrease in absenteeism. So I think that it's an important societal message that we are starting school way too early.
Let's go to the other end of the age spectrum, Dr. Lemon, and talk about people who, Alzheimer's, dementia, these have a sleep-related component too, do they not?
Without question. Obviously, this sort of problem is increasing as the population is aging. And although on testing we would see changes in cognitive function, oftentimes one of the earliest features is what's called sundowning. And this is a phenomenon that's very clear-cut, interesting, not completely understood, whereby a patient will start to exhibit confusion, agitation, difficulties with cooperation, sometimes what we call the turning day into night, night into day phenomenon. Whether this has to do with some of the changes in body chemistry that occur during the course of a day. We see fever or temperature increasing reliably, even when there's no fever at the end of the day, is uncertain. But that's certainly one of the features that one can see early in patients who eventually or are developing dementia.